Every year, millions of people around the world suffer from strokes, making it one of the most serious health threats today. While many people are aware of strokes, not everyone understands that there are various types, each with its own causes, symptoms, and treatment methods. Being well informed about the various forms of stroke not only aids in early identification and timely treatment, but also plays a crucial role in prevention, thereby reducing the risk of occurrence. To gain a better understanding of this issue, let's watch this video until the end. Stroke, also known as cerebrovascular accident, is one of the leading causes of death and disability worldwide. It occurs when blood flow to the brain is suddenly disrupted due to a blockage or rupture of a blood vessel, depriving brain cells of oxygen and nutrients. Without timely emergency intervention, a stroke can result in paralysis, loss of speech, cognitive impairment, or even death. According to statistics, for every minute that treatment is delayed after a stroke, approximately 1.9 million brain cells die. In the year 2022 alone, stroke caused the deaths of 165,393 people in the United States. This represented about 17.6% of all deaths from cardiovascular diseases. On average, one person died from a stroke every 3 minutes and 11 seconds. In light of this alarming situation, recognizing warning signs and taking early action are crucial for minimizing brain damage and improving recovery outcomes. There are two main types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke accounts for approximately 85% of all stroke cases and occur when a blood clot or atherosclerotic plaque blocks blood flow to the brain. This can happen in two ways: thrombosis, where a clot forms in a brain artery, and embolism, where a clot travels from the heart or another part of the body to the brain, causing a blockage. Ischemic stroke occurs rapidly and can cause serious damage within just a few minutes if timely intervention is not provided. The second type is a hemorrhagic stroke, which accounts for approximately 15% of all stroke cases but has a higher mortality rate. It occurs when a blood vessel in the brain ruptures, leading to bleeding into brain tissue. This increases pressure inside the skull and damages nerve cells. The main causes of hemorrhagic stroke are typically uncontrolled high blood pressure, brain aneurysms, and congenital malformations of blood vessels. Compared to ischemic strokes, hemorrhagic strokes are more challenging to treat and often lead to more severe complications. In addition to these two main types, there is a condition known as transient ischemic attack, TIA. A TIA occurs when blood flow to the brain is temporarily interrupted for a few minutes to hours. Although a TIA does not cause permanent brain damage, it serves as a warning sign of a high risk for a future stroke. Those who have experienced a TIA should be monitored and treated promptly to reduce the risk of a more serious stroke. The underlying mechanism of stroke is directly related to oxygen and nutrient deprivation in the brain. When a blood vessel becomes blocked or bursts, the affected brain area ceases to function properly, leading to cell damage. The severity of a stroke depends on the location of the damage, the time it takes to receive medical attention, and the extent of the blockage or bleeding. If a stroke occurs in the left hemisphere of the brain, the patient may experience paralysis on the right side and difficulties with speech. On the contrary, if it occurs in the right hemisphere of the brain, the patient may experience disorientation or cognitive decline. In general, a stroke occurs when there is an interruption of blood flow to the brain, which can be caused by a blocked artery, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. These causes often arise from diseases or unhealthy lifestyle choices. One of the most common causes of stroke is high blood pressure. When blood pressure remains elevated for a prolonged period, the excessive pressure on blood vessel walls weakens them, increasing the risk of rupture and hemorrhagic stroke. Additionally, High blood pressure contributes to the formation of blood clots, which can obstruct arteries and cause ischemic stroke. Diabetes is another concerning factor, as prolonged high blood sugar levels can damage blood vessels, making them more susceptible to blockages and increasing the likelihood of stroke. Besides, cardiovascular diseases also play a crucial role in the development of strokes. Atrial fibrillation, a type of irregular heartbeat, can lead to the formation of blood clots in the heart. These clots can then travel to the brain and block arteries. Atherosclerosis, where fatty deposits build up in blood vessels, can also narrow or obstruct arteries, restricting blood flow to the brain. Dyslipidemia, including high cholesterol, also increases the likelihood of plaque formation, which in turn raises the risk of stroke. In addition to pathological factors, there are several other factors that can increase the risk of stroke. Some are non-modifiable, such as age, gender, and family history. Individuals over 55 are at higher risk, and men are generally more prone to strokes than women. Additionally, if someone in the family has had a stroke, the other family members are at a higher risk of developing the disease. This increased risk may be due to genetic factors associated with high blood pressure or lipid disorders. However, many factors that contribute to strokes can be managed by making lifestyle changes. Smoking is a leading cause of stroke, as the toxic chemicals in tobacco damage blood vessels, promote clot formation, and accelerate atherosclerosis. Similarly, excessive alcohol consumption can lead to increased blood pressure, weakened blood vessels, and a higher risk of stroke. An unhealthy diet, high in fat, salt, and sugar, can lead to obesity, increased cholesterol levels, and diabetes, all of which are significant risk factors for stroke. Finally, chronic stress can also elevate blood pressure and negatively affect cardiovascular health. Therefore, managing risk factors through healthy lifestyle choices, including a balanced diet, maintaining a healthy weight, regular exercise, and stress reduction, can significantly lower the likelihood of stroke. The symptoms of a stroke often appear suddenly and may include oromandibular dystonia, facial paralysis, weakness or paralysis of the arms and legs, usually on one side of the body, difficulty speaking or inability to speak, dizziness, loss of balance, a severe unexplained headache, and vision loss in one or both eyes. To quickly identify a stroke, you can use the FAST rule. PS. Mind check. If one side of the face is drooping, a arms mind check. If the person can raise both arms, seats. Mind check. If the speech is slurred or incoherent. Time. If you notice any signs, call emergency services immediately. In addition to the signs, according to the FAST rule, a stroke may also be accompanied by many other symptoms. Some individuals may suddenly lose vision in one or both eyes, experience blurred vision, or see distorted images. Balance disorders and unusual dizziness can also be warning signs, especially when accompanied by difficulty walking or coordinating movements. Many patients experience severe headaches of unknown origin, which may be accompanied by nausea or vomiting. This is often a sign of a hemorrhagic stroke caused by a ruptured blood vessel in the brain. In some cases, patients may suddenly become confused, lose the ability to recognize loved ones, or fail to understand what others are saying. This symptom may be accompanied by transient loss of consciousness or coma in severe cases. When encountering someone having a stroke, it is essential to call emergency services immediately, place the patient on their side to avoid the risk of choking, refrain from giving food, drink, or medications without medical guidance, and observe the symptoms and the onset time to provide information to the doctor. Do not move the patient unless absolutely necessary. The treatment methods for stroke depend on the type of stroke the patient is experiencing. For ischemic stroke, the primary treatment is the use of thrombolytic medication, commonly referred to as TPA, which aims to dissolve the blood clot causing the blockage in the brain's blood vessels. To achieve the highest effectiveness, TPA should be administered within approximately 3 to 4.5 hours after symptoms appear. Additionally, endovascular intervention is also an option, in which doctors use special instruments to directly remove the blood clot from the brain's blood vessels. This method can be performed within 6 to 24 hours from the onset of symptoms. For hemorrhagic stroke, treatment focuses on controlling blood pressure using hemostatic medications and, in some cases, performing surgery to remove blood clots or treat aneurysms. After the acute phase, patients need rehabilitation to regain mobility, language, and cognitive abilities. Moreover, stroke prevention plays a crucial role in reducing the risk of the disease. Controlling blood pressure, diabetes, and blood lipids through a healthy diet, reducing salt and saturated fat intake, maintaining a healthy weight, and exercising regularly can significantly reduce the risk of stroke. Additionally, quitting smoking and limiting alcohol consumption are also effective preventive measures. Certain foods may help prevent strokes, including leafy greens like kale and spinach, which help lower blood pressure, berries such as strawberries and blueberries, which contain flavonoids that protect brain cells, fatty fish like salmon and mackerel, rich in omega-3 fatty acids that help prevent blood clots, nuts like almonds and walnuts, which provide healthy fats beneficial for cardiovascular health, and whole grains like brown rice and quinoa, which improve vascular function. Furthermore, garlic, tomatoes, and dark chocolate are also beneficial for lowering blood pressure and enhancing blood circulation. In summary, strokes are a major health problem worldwide and can cause disability or death if not treated promptly. Understanding the different types of strokes, recognizing the early warning signs, and acting quickly can help improve survival rates and chances of recovery. While there are some risk factors we cannot control, many can be managed through lifestyle changes, such as eating a healthy diet, exercising regularly, and avoiding smoking and excessive alcohol consumption. By focusing on prevention and raising awareness, individuals and communities can work together to reduce the impact of strokes and improve overall health.